change the way you age. Yes, you heard me. You can change the way you age, and I'm going to teach you how. I'm Dr. Tracy Page, and I will help you feel better, live healthier, look better, and improve your cognitive function. We will look at functional, cellular, and regenerative medicine, and I will teach you how to change the way you age. Let's get started on today's topic. Today, we're going to talk about functional, cellular, and regenerative medicine. If you're new to the podcast, you may be wondering, why do I always return to functional, cellular, and regenerative medicine? And so today I want to explain to you why. I want to explain what these medical disciplines really do, how they approach medicine, and why they're so needed and why they're different from our traditional medical approach. Now, I'm an MD. I trained at a wonderful institution, very research-based, and I feel like I learned the science behind medical practices. But there were things that are missing. There were things that I didn't learn. There are things that we're not teaching in our medical schools. We're not teaching much about nutrition. We're not teaching much about stress. We're not talking about sleep. We're not talking about diet. We're not talking about digestion and toxins and exercise and the side effects of medications and basic things like our hormones. Like, I cannot tell you how many patients come to me and their provider doesn't want to check their hormones or doesn't check their hormones and tells them it doesn't matter anyways. But it does matter. So what I just described to you was the components of functional medicine. True health, when you're practicing functional medicine, focuses on diet, sleep, digestion, stress, hormones, exposure to toxins, your genetic makeup, the medications and the supplements you take, and the exercise you do or don't do. So why do we have functional medicine? It's because we have chronic disease, and treating patients based on their symptoms and alleviating symptoms, although may seem good in the moment, unless we look at the root cause of those symptoms, they just come back. Or unfortunately, what we may see is that patients then develop other symptoms based on the treatment they received. A very good example is a patient may go to their doctor and say, I have reflux. And instead of looking at the patient's diet and their stress level and maybe the foods that they're taking in, how if they eat right before they go to bed, instead of looking at all of these modifiable lifestyle changes, we give them a proton pump inhibitor, which suppresses the acid in their stomach, which then they don't feel any nausea or they don't have any reflux. And so they feel better, but then the patient doesn't produce acid like they're supposed to. We normally should produce acid in our stomach. That's how we break down our food. That's how we kill off toxins that we consume that we're not aware of. So this person now who's on a proton pump inhibitor then has no acid. So they have bacteria that start growing in their small intestine, which are not supposed to be there. And they may develop then small intestinal bacteria overgrowth. So now they have two problems. Not only do they have a reflux, which they don't know what's causing it, they just know their symptoms are gone. And now they may have what we call SIBO, small intestinal bacteria overgrowth. So functional medicine really stops and takes a look at the root cause. We have so much chronic disease, and there is a gap between symptom development and root cause. There's a gap between there that we need to look at and we need to identify to make sure that we are treating the root cause, because then we don't need the medication. I believe 150% that acute care to medicine is good and bad. So what I mean is we need medicine. We need medical training. We need all of those things, especially if someone comes in and they're having a heart attack, they've broken a bone, they're having a stroke, they have a brain tumor. So we need to go in, we need to fix those things. And that's the beauty of modern medicine. But when we have chronic disease, we really have to look at modifiable lifestyle factors. We have to look at what foods are you consuming? How are you managing your stress? How are you living your life? Are you sleeping? Are you having time for fun? Are you exercising? Nutrition, diet, exercise, sleep, it always comes down to these things. And that's where functional medicine really, really, really looks and talks to patients and helps them with their care. So we don't have to have chronic disease. We don't have to take medication after medication. I just talked to a patient the other day who said, my doctor told me I'll always have diabetes, type 2 diabetes, the rest of my life. And that's not true. You don't have to have type 2 diabetes. You can reverse your blood sugar. You can decrease your insulin resistance. You can lose weight. Like, these are possibilities. You don't have to live with type 2 diabetes. You don't have to go on insulin. So we need functional medicine. Functional medicine is patient-centered care. The focus of functional medicine is on the patient, promoting health as a positive vitality beyond just the absence of disease. Functional medicine looks upstream. I tell that to my patients all the time. I don't just look at where you are right now. When I look at your labs and I look at how you present clinically, I think about what are you going to be like in 5 years, in 10 years, in 15 years or more. So we really want to hone in on where a patient is going when we look at how they are clinically. It can be a combination of their genetic makeup. It could be their lifestyle. It could be external factors like their social environment or their physical environment. There's so many things that contribute to overall health and wellness. And I believe that there should always be a combination of functional medicine that integrates with Western medicine practices. So it's not that you have one or the other. It's not that one is better than the other. They're both needed. And the best type of care is the kind of care where it's rooted in science, and it also looks at a functional medicine approach. So it can be a combination of diagnostic techniques such as labs, medications, herbs and supplements, diet, detoxification, stress management, exercise. It's everything. It's understanding the origin, the prevention, and the treatment of complex chronic disease. Now, I just described to you functional medicine and why it's so important. Now I want to talk to you about cellular medicine, because I would say most patients really don't know anything about cellular medicine. And I honestly have to say, a few years ago, I didn't either. And I found that I had really studied functional integrative medicine. I went to wonderful universities. So when I came across cellular medicine, I came across peptides, which are strings of amino acids that are put together that create a function. And peptides are signaling agents. So they signal to create something to happen. But what's really interesting about cellular medicine is it's really cell-based therapy, where it involves modifying a patient's own cells, and in some cases, cells from a donor. And this is to fight disease or alleviate a medical condition. Now, we kind of think of cellular medicine as a stem cell procedure. Maybe someone has a blood cancer, leukemia, or lymphoma, and they need a bone marrow aspirate and they need a stem cell treatment. And I'm not talking about that. I in my practice, do bone marrow aspirates, and I do take stem cells from patients' pelvic bones, but I do that in order to do what's called a stem cell procedure for joint arthritis. So that's a little bit different than what most people think of when they think of stem cell procedures. But cell therapies can be used, especially peptide therapies, as signaling agents to modify and to help the cells come into balance. So all of our cells are amazing, and they do amazing things. They create energy from our mitochondria. They fold and unfold proteins. They help us make muscle. They help us have energy, ATP, NAD, NADPH. All these things are happening in the cell. And it's not important about the science for the everyday listener. It's not important that you know how much ATP is produced. What's really important is that the cell is an amazing entity that can be signaled to improve itself. And what's so great about cellular medicine is that the cell is super smart, much smarter than we are. And the cell is able to take signaling agents that we may give to the patient, either orally or by injection, and it can go to the cell and it helps the cell function in a way that it's supposed to function. Before we started eating the mac and cheese, before we started going to the fast food restaurants, before we stopped exercising, before we started experiencing all the stress, we were young and healthy and vibrant. Our cells are amazing. They did what they were supposed to do. And so when we get older and our cells slow down and they don't function as well and they're not in homeostasis, they're not balanced, they stop doing what they're supposed to do and they have modulation, and that means they can slow down and change. That means they can speed up and do something they're not supposed to do, and they can change. And so it's so important to know that we have the ability to help our cells come back into balance. And you can't just take a pill or have an injection of a peptide and think that that's going to fix everything. I try to educate my patients so often. I tell them that we have to have some basic things in place in order for us to maximize any type of peptide therapy that they do. And those things are, and you're going to hear this over and over again in these podcasts, they are sleep, they are stress management, they are good nutrition, exercise and movement, all those modifiable lifestyle things that we need to do, drink our water, go for a walk, sleep, and sleep. All of those things really have to be the foundation of someone's life if they want to change the way they age. And then you add in the peptides or the supplements or medications that really can take you to the next level. Improve that cognitive function, help your skin look better, your eyes are brighter, your energy is improved, your body composition changes. All of those things happen once you have the basics down. So it's really important to have the basics down and to really understand that those are the foundation, and then you can add in cellular medicine. So all of us as adults, we have millions of stem cells, and they're found in every human. Our stem cells are made in our bone marrow, and our body uses these stem cells as a way of repairing itself. So we have many studies that have illustrated that adult stem cells can be harvested and they can be injected at a site that is diseased or damaged. So for instance, I mentioned that I use stem cells for my patients. So I will use them for patients who have arthritis, and it might be a patient who's not ready to have surgery, such as they may have knee arthritis and they're just not ready to undergo surgery, and they want something to help alleviate the pain or the function that has changed because of discomfort in the arthritic joint, or someone who has an arthritic hip. And again, they may have a loss of function or pain. And so therefore, they're looking for a procedure that's not surgery and that's natural. And so you can take the stem cells out of their bone, you can spin them, and you can put them in a machine that separates out all of those wonderful stem cells, then put them back into a joint and help that joint regrow cartilage, help that degenerative tissue improve. So it is possible. And these stem cells, I said from a bone, but they can also be collected from blood. They can be collected from fat, bone marrow, skeletal muscle. There's many sources. There's even cord blood that provides yet another source of adult stem cells. And, there are regulations around these. And so this is just an overview of cellular therapy. And that's just one thing. So I talked to you about stem cells. There's also the ability to take blood and to spin out platelets and plasma. And you can get platelet-rich plasma. And you can put that into a joint or into a soft tissue like a tendon that won't heal or a ligament that won't heal. And you'll bring all those growth factors in and allow them to heal. And I'll do a podcast just on stem cell and just on PRP, platelet-rich plasma. I'll go a little bit deeper. Today, I just wanted to give you an overview of the different types of medicine that we practice here at Wisconsin Institute of Functional Medicine to help our patients change the way they age. So we talked about functional medicine, and we've talked about cellular medicine. And I didn't go deep into cellular medicine, but I wanted to say also that we have peptides, and we use peptides quite a bit in our practice. And peptides are just cellular signaling to help the cells improve and to return to homeostasis. And so we maximize our own cells' ability to do what it's supposed to do. When we're young, we have amazing amounts of growth hormone. And that growth hormone helps us have energy, helps us maintain our body composition, keeps us lean with more muscle than fat, helps our brain function. It helps our bones be strong. It helps so many different areas of our life, our cognitive function, our digestion, just our immune system. I mean, I could go on and on and on. So as we get older, we don't lose our ability to make growth hormone, but we do lose our ability to signal our anterior pituitary to make growth hormone. And if a patient comes into me and they want to feel healthier, sleep better, live better, have more energy, have improved skin, hair, and nails, improve their digestion, improve their libido, I mean, so many things that they want as they get older, I can look to peptides and help them. But again, I always go back to, you have to have kind of like growing a garden. You can't put seeds in bad soil, right? You can't expect to put peptides into a body of someone who's inflamed, who's not taking care of themselves, who's not sleeping, who's not eating well. I mean, it's just really a waste of their money and their time. So, but we do have these peptides that can help them have improved bone function, libido, sleep, digestion, body composition, energy, all of those things. And they're just signaling agents that help you create more of your own growth hormone. And they're pretty impressive. And I will do a whole podcast on peptides as well. And I'll probably just break it down to different ones. Actually, I'm going to have a guest speaker, a pharmacist, come on pretty soon. And we're going to go through brain and body optimization using peptides. We're going to talk about hair optimization. We're going to talk about cognitive optimization. And all of these things you can do with peptides and with a practitioner who knows how to use them. And so I'm very lucky and fortunate that I've been part of the SEED Scientific Research and Performance Institute, where I have learned and took a whole year on studying peptides, and now I'm part of that faculty. And so I'm love to share my information on everything that I'm teaching and learning, and it's all good. And I benefited from peptides myself. So I'll love to share with you my experience as well. Okay. The last thing I want to talk to you about is regenerative medicine. And I kind of talked to you a little bit about it already, because regenerative medicine seeks to replace tissue and even organs that have been damaged by disease, trauma, congenital issues, all different types of things. So the one I talked to you about was joints and replacing of cartilage. And that's where, again, you take the stem cells out and you put them in an area where you need to grow new cartilage. You can use a combination of these approaches. Sometimes you'll want to use something as a scaffold to put those stem cells on. So some of my colleagues will do platelet-rich plasma first, say in a knee joint, and then a week later, they'll put the stem cells in. Some of my colleagues use exosomes, and I'll talk a little bit more about those and how we use those to help generate new cartilage and new tissue. So that is regenerative medicine, and regenerative medicine and cellular medicine can really combine together to create amazing results for patients. Again, everything I feel starts at the cell. And so you really have to lay the foundation in order to get good outcomes when you're going to do regenerative medicine. And regenerative medicine has been used in hair restoration. It has been used in facial rejuvenation. So instead of putting foreign products such as fillers in your face, there are practitioners who use your own fat cells, they use your own stem cells, and they put them in the tissue on the face in order for you to generate your own collagen and to give you that fullness and plumpness and that young look that so many patients seek as they get older without having to put in artificial things into your face. So the combination of all of these functional, cellular, and regenerative medicine can really change the way you age. And I'm just a believer. I mean, I've practiced these things in my clinical practice. I've seen patients get better. I've seen 70-year-old women come into my practice who can't sleep, who then have a plethora of problems because they're not sleeping. They have loss of cognitive function. They lose weight. They lose their energy. They are not as social. I mean, all of these things happen because they're not sleeping. Then they may eat foods that are not good for them. And all I do, I should say, is I might start them on a peptide that helps them regain their circadian rhythm, that helps them sleep soundly through the night, that doesn't have really any side effects whatsoever. And then once they start sleeping, their brain function improves, their energy improves, their mood improves, their outlook improves, their social skills improve because they are more energetic and they want to go out and be with people. So one peptide, that's it. I have seen patients come in and they have tendinitis on their elbow, and I'll use a peptide like BPC 157, do several little injections, and their tendinitis will completely resolve without the use of steroids, without the use of anti-inflammatories that can cause ulcers in the stomach and affect the kidneys, just from one peptide. So I love cellular and regenerative medicine. I love what it can do for my patients and for myself. But again, it always comes back to you have to use functional medicine as well, because you really have to make sure that the patient is practicing modifiable lifestyle factors: sleep, nutrition, movement, stress management. I mean, it really comes down to those 4 things. And if you are managing those 4 things, then the other disciplines, cellular and regenerative medicine, can make a huge difference. So I'm super excited. I changed the podcast because I really wanted to talk about all of these things, because I didn't even talk to you about peptides and weight loss. And there's peptides and hair restoration. There's so many wonderful ways that I can help my patients now because I have this education and I'm learning more every day. And I'm so excited to share it with you to help you change the way you age. So we will go through different topics, and we will always look at a functional, cellular, and if appropriate, regenerative medicine approach to help you change the way you age. I hope that you'll tune in. If you have a particular topic you'd like to talk about, I hope that you will reach out and leave me a message on the website. You can ask me any questions, and I will love to research it and to bring the science to you and to help you understand how you can change the way you age. Thank you for listening. Please remember, this podcast is for educational purposes only. It is not a diagnosis nor a prescription for care. If you are interested in learning more, please go to wisconsinfunctionalmed.com. All one word, wisconsinfunctionalmed.com. Until next time, live well and change the way you age.